Good afternoon, good morning, good afternoon, and good evening, and welcome to the session, Taking the Field Forward, Evidence on What Works to End Child Marriage. My name is Ramya Subramanian, and I work at the UNICEF Office of Research Innocenti. We have just 45 minutes today to catch up on all that is happening in the field of child marriage research, a bit of a bird's eye view of a very dynamic, engaged, and rapidly evolving field. And today we have some of the leading global experts with us who have been reviewing the evidence landscape and have rich insights and perspectives to share with us today. And I know we're also building on a very interesting and rich discussion on data in the preceding session. So I really hope we will have a rich conversation connecting those pieces as well. The session is organized in 3 parts. First, to take stock, we have Margaret Green from Greenworks Consultancy, who will be presenting the child marriage evidence food chain, a very interesting concept, based on an examination of the evidence reviews that have recently taken place in the field of child marriage. Her co-presenter is Manahil Siddiqui from the University of Washington School of Public Health, and Manahil will be available in the chat to provide the links to the resources or clarify any questions that may emerge from the presentation. The second part is a more interactive discussion with 3 panelists who will each respond to one question posed to them, which will allow them to really point to what we have learned from these recent global reviews. So sort of diving deeper into the presentation that Meg will have made. And they will also reflect on where we need to go next as a field. So really about setting priorities and seeing what we need to do. And our panelists are Venkatraman Chandramouli from the WHO, Yvette Efevbera from the Gates Foundation, and Anju Malhotra, currently with the UN University International Institute of Global Health. And I know they're all extremely well known to many of you, and you will really enjoy hearing from them today. If time permits, we will be looking for burning questions from our participants to pose to our panelists. So please feel free to use the Q&A function to raise any questions, and please start posting your questions from the beginning so we have time to really go through them and pick at least hopefully 1 or 2 of them for our panelists to address. In our final part, Satvika Chalasani, who is at UNFPA, and again known to almost everyone, will tell us how the Global Programme's research strategy sets out priorities for phase 2 and beyond, how COVID-19 has necessitated some shifts and what that means for evidence generation. And she will also tell us about some new developments in strengthening technical assistance on research and knowledge management. And then with that, we will close this very quick 45-minute session. The detailed bios for all the speakers are available on the website. And as time is short, I'm going to therefore hand over now to Margaret for her first opening presentation, where she will be landscaping the evidence for child marriage. And Margaret, over to you. We'd like you to tell us why evidence matters now, and more so than ever before, perhaps, what the state of evidence is, what we know, where the gaps are, and perhaps some reflections on how evidence is being used. So over to you. Take it away.
Great. Thank you so much. Thank you for the opportunity to speak today. And as you can hear from Ramya's introduction to my presentation, it's an easy assignment with almost nothing to talk about. But really, the child marriage field has been buzzing with activity, and together we've been asking critical questions around the evolution of the practice, what we know about what works to prevent this harmful practice, and finally, which areas are critical for attention and investment. So our assignment today is to summarize all of this research activity on child marriage and to answer these questions. What is the role of evidence in child marriage prevention? What have recent efforts shown us, and what are the gaps? And how do we ensure that this evidence is taken up to accomplish our collective goal of ending child marriage and improving the lives of girls? Next slide, please. Without evidence, we are operating in the dark. Next, please. What if we lived in a world where decisions in policy and practice were evidence-based? Would we realize an end to child marriage sooner? Evidence basically boils down to getting to the truth about child marriage and what needs to be done in order to address it. But it isn't a silver bullet. context matters, as do the ways that we communicate the evidence and to whom. So we have to work toward a field-wide perspective on what we know and how this information can be mobilized. Without evidence, we're really in the dark. Next slide, please. So basing policy and practice on evidence requires a number of mechanisms that interact with each other. And we've called this a food chain because there are producers whose products are transformed into inputs that are then taken up by other consumers and passed along. And the child marriage field has been very busy working on all of these aspects. Yet when we talk about the state of the evidence, we're often focused on specific elements of this food chain, usually those that reflect our own position in this system. What we'd like to do today is to take a broader perspective on the consequential relationships between the parts of this dynamic system. And it's our sense that if researchers, programmers, policymakers, and advocates were more fully engaged with each other, their shared commitment to improving girls' lives would make the evidence food chain more effective and powerful. Next slide, please. So we have three key takeaways on the overall state of the evidence at the highest level, and we'll share data on each of these. First, research on child marriage has increased dramatically over the last 20 plus years, and that going forward, more attention needs to go beyond describing the practice and to focus more on responding to it. Secondly, the research is not necessarily concentrated in the settings that need it the most, and very little research has been conducted in certain high prevalence countries. And finally, we identify a clear need to mobilize greater North-South collaboration and to decolonize research. And I'll say more about that in just a moment. Next slide, please. So Manahil Siddiqui and my systematic scoping review of publications in English, French, Spanish, and Portuguese across all geographies between 2000 and the present reveals the evolution of our field over 2 decades. You can see that in the early 2000s, our knowledge of child marriage was extremely limited, with only a handful of publications on the topic. But 2013 was a turning point with lots of other supporting changes, with in 2011, the founding of Girls Not Brides, in 2012, the first United Nations Day of the Girl Child, and in 2015, the inclusion of a specific target to eliminate child marriage in the SDGs, so increasing the prominence of the issue on the global agenda. We have an initial search from 2021, which shows that this upward trend is continuing with regard to the volume of publications. We also assess the distribution of publications based on the area of child marriage research that they focused on, and that's what's shown in the pie chart. And basically what we found is that there's much more research that's formative in nature, examining the prevalence and trends of the practice, its causes, determinants, and consequences. And there's 72% on that, essentially focused on diagnosing the issue. And far less attention has been focused on the solutions or responding to the practice. Only 28% of the publications focus on interventions to prevent child marriage and respond to the needs of girls. And one additional point I wanted to make here is that, interestingly and unfortunately, the intervention literature is published almost entirely in English. So that is a huge opportunity for the field to publish more in the other languages. Next slide, please. Oh, I'm sorry that the pie chart didn't appear at first. Next slide. Thank you. In an analysis that we've conducted of research on interventions across the African continent, we see that their distribution is highly uneven. We were quite shocked by the comparative neglect of certain high prevalence countries uncovered by our data. In particular, Eritrea, South Sudan, Somalia, the Central African Republic, and Mauritania all have some of the highest prevalence of child marriage in the world, yet are the focus of very few publications. Eritrea, for example, where 41% of girls marry as children, ranks 114th, with only 3 studies on child marriage published between 2000 and 2019. And although 339 publications were generated on sub-Saharan Africa between 2000 and 2019, these focused on a handful of countries, including Ethiopia with 40% child marriage prevalence, which ranks second in number of publications, and Niger with 76% child marriage prevalence, which ranks 4th in publication ranking. And Nigeria, Malawi, and Uganda are other settings where there's a lot of research focus and attention. Next slide, please. So our database allows us to look at the country of the first author's institution, and it reveals a stunning distortion in who is generating the evidence on child marriage. 42% of first authors of our studies, of studies in our child marriage database of 1,068 studies are based in the US or the UK. So, for example, 368 first authors are based in the US, but only 23 of those studies were actually on child marriage in North America. And then in contrast, 90 first authors were based in India, and the research of 84 of them was focused on South Asia. So this figure reflects the reality that first Global South researchers often lack the resources and institutional platforms for their work to be widely disseminated. The availability of DHS and other data for secondary analysis makes it easy for Global North researchers to conduct research on the Global South, and priority setting exercises often convene experts from the Global North. So we're not at all saying that everyone should study the region in which they are based, but our analysis makes it possible to look at the whole field as a collective endeavor, and there are clearly important opportunities for realizing a shared vision while being mindful of the biases that exist in child marriage research. Next slide, please. So I really, there's just been so much happening, and I can see that I'm not going to be able to get through all of the material that I have prepared in my presentation. I'm very glad that you'll be receiving the slides. But basically, here I want to highlight, some wonderful recent reports, both document the UN data report documenting trends in child marriage, and then just 2 supplements that are coming up. One that's focused on modeling the drivers of child marriage, and the other that's focused on looking at commonalities across a wide range of settings. And then some very valuable evidence syntheses, highly diverse scoping and systematic reviews. I mentioned the Siddiqui and Green database, which we've extended to the present, and it allows us to look at the growth and focus of research on child marriage, geographic distribution of the research, and we'll be writing much more in the coming months. Others that I wanted to highlight were Zaman et al., which is looking at the very sparse data available in Canada and the need to understand motivations for and the consequences of child marriage to promote discussion of the discrepancy between the laws that allow children under the age of 18 to marry, although Canada as a country is highly committed internationally to end the practice. Then Malhotra and El-Naqib conducted a comprehensive systematic review of interventions to end child marriage, and I hope that Anju will be speaking more about their results in a few minutes. They find that interventions that support girls' schooling through cash or in-kind transfers show the greatest success in preventing child marriage. And also they show a low success rate for multi-component versus single focus interventions. And then El Arab and Sagbakan, a systematic review that is one of the few that focuses on girls in humanitarian contexts. So evidence synthesis is a critical component of the evidence food chain and offers a clear and comprehensive assessment of what we know in a particular area. We've highlighted just a few of the latest systematic reviews, but there are many others that advance our understanding of the evidence, either on particular regions, issues, or interventions. We wanted to highlight 4 key gaps that stand out to us after our efforts to wrap our arms around the range of studies and reviews of studies described here. First, we need greater agreement on points of measurement, definitions, quality, and classification of strategies to address child marriage. We also need to gain a better grasp of and take into account the impacts of COVID on prevention programming in the lives of adolescent girls and boys. The understanding the ambiguity in the status of marriage and adolescence in rich countries and the tendency to view laws as impossible to evaluate is an important area as well. And then finally, so much of the research is written as if male partners did not exist, and we need much more insights into the nature of the marital relationship as well as the experiences of divorced and widowed girls. I have additional slides, but I am going to conclude my presentation here. And so I guess, yes, if we just go to the end, thank you. So I just wanted to go to this slide from the recent UNICEF data report. It's distressing to see that in several regions, child marriage rates in the poorest households are not just stagnating, they appear to have risen. Child marriage remains a response to economic and social stress, and we can only imagine what these curves will look like once the impact of COVID has been captured. Strangely, though, the gap we see here has a hopeful dimension to it. So culture is often offered as a defense against specific kinds of unwelcome change in established social practices and institutions. Yet in one of the most important indicators of the flexibility of culture, elites virtually everywhere are abandoning the practice of child marriage. And so these data show how virtually every with so many practices, including apparently timeless marriage practices, that these practices can change when people have greater resources, flexibility, and the freedom to decide for themselves. And our mobilization of the evidence is key to feeding into that process and bringing about change. Thank you.
Thank you so much, Margaret. Lots of thought there. Your presentation is already up on the website, on the platform. So please encourage everyone to look at it. I think it was kind of interesting what you presented, the ecosystem at the start, and then you also talked to us about the bubbles that exist within that ecosystem, perhaps, and how we maybe need to really be joining the dots on a lot of things, yeah? But who's producing the evidence, where it's distributed, and so on. So I think a really nice landscaping to set out for our panelists. So I'm going to turn straight to our panelists, and I'm going to start with you, Chandra. You've been listening to Margaret, you know the work. This has been the work she presented has been also, discussed and debated at many fora. So I'd like to ask you, what are the key gaps and questions that remain to be addressed as a matter of priority, building on what Meg said. What remains, what are questions that remain unresolved, what requires further evidence, and so on. Because also in the chat, we're seeing the same kinds of questions. Well, what do we need to be doing? So over to you for a few minutes to tell us what you think.
Thank you, Ramya. So I'm going to point to 4 gaps, and they're from a paper published in the BMC Reproductive Health Journal, updated research gaps on ending child marriage and supporting married girls for 2020 to 2030. Perhaps Manahil could put it in the chat. So 4 gaps. And the first one is in relation to prevalence, trends, determinants, and correlates. There's a lot of national, regional, and global level data. In Meg's last slide, she presented an overview across the world. what is needed is subnational and subpopulation level data so that we can, and ideally disaggregated by sex, by age, and year by year. That will help us understand the situation and decide exactly where investment is needed. So research in this area needs to be much more granular. That's the first area. The second area is consequences of child marriage. There's a fair amount of information on the health consequences of very young mothers and their babies. And often this data is available with a very short-term perspective. What would be really useful is evidence on consequences across the life course in health, including mental health, education, employment, but for both young women and their male partners. And also something that Meg said about family size, about structure, about relations, about power, about violence in this context. Another area, again, something that Meg touched on, is we need evidence urgently on marriage transitions. What happens when marriages end, with separation, with divorce, with desertion, with widowhood. So in this area, it's the takeaway is a research that goes beyond short-term consequences and health consequences. The third area, intervention effectiveness studies. Now, this has been a huge bulk of the research that has been carried out. In addition to prevalence, is intervention effectiveness. Now, studies and evaluations are needed in areas where evidence is mixed and in areas where few studies have been carried out, like, again, Meg and Manahil have pointed out. One area in which research is urgently needed is, the feasibility and effectiveness of single interventions combined versus a package of interventions. So here, our takeaway message is research on intervention effectiveness only when it is really needed. This is easier to do than implementation research, and this is where a lot of duplicative research is being carried out. The last area is implementation research. Our clear sense in our global meeting in 2019 and in our paper is that we need both retrospective and prospective implementation research in three areas. One is delivery platforms. Given that the highest rates of child marriage are in poor communities, in people who are hardest to reach, the challenge is delivering programs when the tarmac ends. So it's beyond the tarmac. What do you do in the poorest communities when the needs are the highest and institutions are weak? So that's where we need a lot of information. The second is the role of civil societies in scale-up. CSOs have played a central role in child marriage for the last 2 decades, for the last 3 decades and more. One of the research questions we identified is, what support do CSOs need in areas where governments are weak or governments are not really committed to this area? What is it that CSOs can do? What support do they need to deliver? So really the takeaway message is, what do we need to do to enable CSOs to do what no one else is doing? And the last area is large-scale programs. We have a number of issues on investment, on policies, and scale-up. And here the message is, we need to learn from what is being done in the field. We need to document, we need to evaluate, how these programs were set up. Research studies and projects are written up because they're easy to write up. Journals like them, editors love them. Real life programs are messy, they're difficult, and they're often not written up. That's where we need to learn from. And in the context of COVID-19, we absolutely need to learn from the lessons learned. My last point is failures, missteps. We always like to write about things that work well. We don't talk about things that don't work well. And we really need to create a climate where government programs, NGOs can talk about things that don't work well. There's a recently published brief on female genital mutilation. And I love that section on interventions that don't work. Increasingly, we need to start putting those things on the agenda as well. Thank you, Ramya.
Thank you so much, Chandra. And actually, I'm going to turn to Anju next, because I think many of the questions you're raising, you've talked about granularity, mess, getting down to the ground, focusing where there are real gaps, real needs, where nobody's looking. It links a bit to Meg's point about how several high prevalence countries don't actually have sufficient evidence, etc. And then you raise this issue then also about scale and the issue about evidence around single component interventions and how we seem to know more about them than we do about multi-country. So I'm going to turn to Anju. Anju, you're interested also in the issues of scale up and you know the challenges of really when you measure interventions that are effective in a particular context, how do you take them forward? What are the questions? How do you address adaptation, adaptability? And I know you have a few slides for us, so why don't I ask you to take us through them in about 3-4 minutes, because time is tight. And in the meantime, colleagues, please put questions in. I know Manahil is answering them, but if there are any questions you would like to address the panelists, please write them down now so we don't miss them. Over to you, Anju.
Thanks, Ramya. Can you hear me well?
Yes.
Thank you for having me, and it's great to follow Chandra because I think we agree on so many points, and I think nothing is more important than learning from implementation and learning from both successes and failures. So I want to pick up on what Chandra said on that and talk a little bit based on this, both the scoping review that Shada, my co-author, and I did for the global program, which you can find on the UNICEF and UNFPA website, as well as our systematic review that we published, because our thinking was precisely how do we learn from this and move forward. We, in our systematic review, we looked at over 30 evaluated programs. So that doesn't tell us necessarily all the work that's going on, because there's a lot of there are a lot of intentional and unintentional interventions that are affecting child marriage that are not being evaluated, and that's an area that we should be turning to. But we looked at the ones that have been evaluated, and we were fortunate enough, because the evidence base has built up so much over the last 20 years, that there were 11 multi-component studies that have been evaluated and 11 conditional cash transfers. So that's a pretty large chunk to sort of see a pattern. And what we interestingly found was that the multi-component studies, which seems to be the most common way that we try to affect child marriage, had both a very low success rate as well as they almost never went to scale. In contrast, conditional cash transfers for girls, when it was supporting their education, had a very high success rate, and a lot of those programs were on scale. There were other promising options with less robust evidence. So, for example, we also found 2 studies that showed that when government policy support job opportunities for young women, then they're both the intervention is both at scale and successful. And similarly, interestingly, we found that life skills or gender training interventions are more successful, at least 2 studies, that when they were by themselves rather than when they were in multi-component programs. Next slide, please. So what we find here is that complex interventions are not necessarily easy to do, and it again comes back to Chandra's point that we are often working in very low resource settings, which is where the rates are high, and the institutional and infrastructural backup to do the work isn't necessarily there, and to scale up isn't necessarily there. What's daunting, I think, is that despite all the evidence and programming that we have, we are nowhere near reaching the SDG target, and because we are not working at scale. So I put some numbers at, I'm suggesting that we look at least reaching 25% of the girls at risk in any given country, which in Zambia would mean reaching at least 125,000 girls, and in Bangladesh would mean reaching 2.25 million girls. But our typical program reaches about 5,000 girls. So in the last 20 years, we're finding that the programs we're doing most often are not reaching scale, and we need to shift our thinking. And we know that there are good reasons why they're not reaching scale. We have a lot of logistical and capacity and time and resource challenges. Communities don't always want all the things that we're giving them, and they want other things. There's no sectoral home for a lot of our multi-component programs. We rely on donors rather than national financing. We don't think about the scale-up pathway from the beginning. We think we're going to prove something, and then, 8 years later, it'll go to scale, and that doesn't always happen. And then interestingly, we have, I think, not focused on the fact that over and over we find that educating a lot of girls, educating large proportions of girls in a community, not only enhances their human capital and skills and life opportunity, and that this approach has been consistently successful, but it also changes norms, because then the community starts thinking of girls as children and potential earners and not wives. And that is a big issue. And in contrast, cash transfers or poverty reduction or other incentive programs that don't invest in girls, but just invest in families, don't necessarily have a lasting change. And that was one of our findings as well. The last slide that I want to share with you suggests some key insights on how we need to now think about scale if we're going to shift our approach. So one is that we have to work with the most powerful and well-funded sectors. Interestingly, I don't think education or health would consider themselves well-funded, but they're certainly better funded than gender or youth ministries or those sectors. And we need to be working with them closely. We need to move from the periphery to the center and influence their core interests more, work with them on their goal, their budget, and start integrating child marriage indicators in their performance tracking. And I think Chandra pointed out the role of civil society and UN organizations, that we need to go beyond advocacy and dig in the weeds with a lot of these sectors and sit with them and really work out the nitty-gritty of the plans and the budgets and the delivery at the subnational, at the district level, and look at where the quality of key initiatives is going to be. And I think that's, instead of having standalone programs that we deliver separately, we need to work with the government and the private sector. And Chandra is right, there's places where the government or the private sector is really lacking, and we need to think about how resources are going to continue flowing to the things that we start in those situations. And I think in many ways—
a quick wrap up now, please, because we're a little over time. Yeah.
So my last point would be that it's time to innovate and seize the day. And in many ways, COVID is a crisis that offers also opportunities. So it is time we can look at some key sectors in a new light. So we can, for example, on education, go beyond cash transfers and look at other things that the education sector is trying to do and start intervening, for example, in having more female teachers, or having digital and remote learning, which we know is leaving girls out in many ways, or the skilling for the 21st century, and especially as the employment sector is looking at countries to configure new work modalities. Where will girls and women fit into that? So that would be my approach to thinking about how we look at scale. We need to stop looking at our belief systems and look at the evidence to really guide us, because many times we're so stuck in the old mode that we can't think in new ways. And I hope we can do that going forward.
Thank you so much, Anju. And actually, just to turn to Yvette, and to make sure she has enough time, Yvette, that was actually also the question we were going to ask you, which is, looking at where Anju ended. But what are those new and innovative ways? What are you seeing in this kind of, Anju located the components of interventions. She talked about the difficulties of these, trying to do these even though we know that multi-component interventions address all these complex drivers. we need to be looking at the different paths as well in which these interventions are nested. So any insights for us from what you're saying about where should we be going? What's new, what's innovative? Where should we be looking at new ideas?
Thanks for the question, Ramya, and really to the Global Program and this group today for an exciting start, I hope, to the conversation. You know, Ramya, I really appreciate your question because it's one of the questions that's been driving the work I've been leading over the last couple of years at the Gates Foundation. And I want to just highlight briefly one of the efforts, the Child Marriage Learning Partners Consortium, which, for those who are less familiar, has brought together 7 research advocacy and implementing organizations, including UNICEF, and was really designed to test and foster more strategic, more coordinated, more effective action by connecting research and learning to program and policy needs. I will stick the information in the chat so that folks can dig into some of the research results that we just launched last week. But just to say, it's one of the ways that we've been trying to think about how to address this question. So 3 things I would highlight for you, and I hope to spur conversation with some of these thoughts. But I want to share a few insights coming out of the consortium's work, but also just my own vantage point as I take a step back, reflect on how this body of work connects, and really think about my own kind of lens from being a researcher in this space for the last decade as well. So one area where I think there are some exciting opportunities is really in this area of driving context-specific understanding of what works to address child marriage. You know, in the conversation around scale up, it's so easy to fall into this one-size-fits-all approach. And I love part of where Anju landed in terms of, you know, yes, there are cash transfers, yes, there are education, but I don't think that's enough. I think that there's an opportunity for us to interrogate what are the specific drivers of child marriage in different contexts. How does that relate or align to different interventions that have been proven effective in certain contexts? What are those pathways that then drive impact? And how do we learn from that and apply it to different settings? That's how I would love us to think about scale up in a slightly different way, a really contextually specific and driven understanding of what drives child marriage. Number 2, I think that there is an opportunity around innovations in measurement and marital dynamics. You know, the world has really coalesced around 18 and 15 as those key markers of how we understand the harms of child and early marriage. And I understand how deeply linked this is to that legal framework and a need to standardize across contexts. But there is an opportunity to push how we measure in standardized and systematic ways areas like forced marriage, areas like marital choice, and how these relate to issues like agency and empowerment and what that means both in the short and long term, as Chandra said, as we think about the impact on child marriage. And number 3, and maybe this is a little controversial, but I think it's time, and I think there are opportunities around identifying alternatives for girls and young women. Preventing child marriage is such an important goal, and I think it's one that many of us can coalesce behind. And I think if we really want to advance what it looks like to put girls and young women on a positive trajectory, we have to recognize that some research in settings like Niger, like Malawi, like Guinea, where I've done some research in the past, points to the fact that if girls don't have alternatives, then there is no better option in some cases than an early marriage. So it would be really exciting to see a wider range of researchers really advance that research to get at what does it look like to create alternatives for adolescent girls and young women so that they truly have and are empowered to choose if, when, and whom they marry. Lastly, let me just end, Ramya, by saying that the what is really important, but also the how we do the work matters too. So I really want to challenge and maybe put out a call to action to those in this group today to push the bounds of what we mean by evidence, whose voices are represented and valued, and also what stakeholders we bring into the ways in which we produce knowledge in actionable ways.
Fantastic, thank you, Yvette. And I think you got a big thumbs up for that point about, trying to look at the chat at the same time and saying, I think it was a big thumbs up for the work on measurement of innovation and measurement innovation, the need to have new methods to find new ways of connecting the granularity. And I think all our panelists today have talked about context, granularity, and learning from the ground and remembering what we're talking about, right? Which is ultimately also about family dynamics, looking at children in different situations. It's not just the married girls, but it's also the single girls, the divorced, the widow, the gamut of experiences, even within this framework of marriage that we're talking about. So I think there's a lot to unpack there, but in the interest of time, I'm going to hand over to Satvika. Satvika, you've listened into all of this, and I know that the Global Programme's also been working on its own research strategy, building on all of these inputs. So tell us about what's happening now in the research strategy.
Thank you, Ramya, and fantastic intervention so far. My name is Satvika. I am UNFPA's lead on ending child marriage and particularly working on the global program. I am really happy to share with all of you, not all of you may have heard, we have a new research strategy in the global program for its phase 2, specifically to respond to all the concerns and questions raised by the panelists so far on where we have the bulk of the evidence and where there are gaps. So we have 5 areas of research priorities, and I'm sure one of my colleagues will share the strategy in the chat. But the first bucket where we're emphasizing evidence generation for the program, for our country offices and regional offices, is on the effectiveness of interventions. The second is on implementation research on questions of scale, sustainability, reaching marginalized populations. The third one is looking at specific groups who are at risk of or affected by child marriage. That includes child marriage in humanitarian settings, married girls, just under-researched subpopulations. The fourth is understanding secular changes in age at marriage. There's a lot going on with modernization, urbanization, big macro trends and how they impact on changes in child marriage. And finally, more work on gender transformation as an overarching strategy and achieving gender equality, particularly for adolescent girls, as an overarching strategy to address child marriage. And so to support the implementation of that research strategy, we have partnered with UNICEF, Ramya and her team at Innocenti, to launch the Strategic Technical Assistance for Research Initiative to End Harmful Practices. And this is really focused on global program countries and colleagues. And it has 3 areas of focus. One is high quality evidence generation. The second one is on evidence synthesis and evidence uptake. Many of our countries have put in expressions of interest, and we have a process of accompaniment for their research. But I just want to share, if there are other countries undertaking new studies, that we are here to support you in ensuring that this work is of high quality and aligned with the global research priorities. A second initiative that I would like to mention is the Child Marriage Research to Action Network. We've partnered with Girls Not Brides to create a platform that's more focused on dissemination. So the STAR initiative is on research production within the global program, and the CRANK platform that we have with Girls Not Brides is more focused on dissemination well beyond the global program. And it provides a platform for a better coordinated and harmonized global research agenda and encouraging the uptake of research by policymakers and practitioners. You can find a link, I'm sure, in the chat soon enough to sign up for CRANK if you haven't already, where you can hear the latest research. So we're advancing in a cohesive way towards our goals, and we welcome you to join us in this. Thank you.
Wonderful. Thank you so much, Satvika. That was really rapid and crisp. I'm sorry that we haven't had time to really pick up any Q&A from the floor, but I think there was one question, maybe don't have time, but there was a question about how we're looking at also things like climate change, some of the more new and new forms of sort of pressure that are generating as we try and work on our evidence base to improve the effectiveness of our interventions. I think there is also a big challenge around how we address these new drivers of marriage that we're seeing. Early marriage, COVID was one of them, of course, and there are others like climate change. So I'm going to just take my last few minutes, the last few seconds to say thank you very much. I'm sorry we haven't had more time, but I think it's a real taste, an excellent taste we've got of a wide range of issues. I want to thank Margaret and Manahil, Satvika, Yvette, Anju, Chandra. Thank you all very much for your preparation and your inputs. I hope everyone will look at the presentations on the sites and also the great resources that have been tabled by Manahil in the chat and other colleagues. And I hope also for the global program, following this midterm review, we will also have a more dedicated session perhaps to follow up on many themes that we didn't really get into. But thank you so much for making a very interactive and exciting session and for keeping us all up to date with what's going on in the field of evidence. Bye, everybody.